Today I am going to discuss some questions from the Robbin and Cotran Atlas Pathology. The first case is a 72-year-old man died suddenly from congestive heart failure. At autopsy, the heart weighed 580 grams and showed marked left ventricular hypertrophy and minimal coronary arterial atherosclerosis. A serum chemistry panel ordered before death shows no abnormality. Which of the following pathological processes best accounts for the appearance of the aortic wall seen in the image? So this image is available in Robbin and Cotran pathology book, and taking this image they have made a question. Here the point you need to remember or you need to pick are the left ventricular hypertrophy. Number second, the patient has coronary arterial atherosclerosis. Number third, the serum chemistry panel showed no abnormality, and they gave an aortic valve in the figure with some lesions. So before going through the answer, you need to know that left ventricular hypertrophy can be seen in case of genetical mutations. It can be seen in case of systemic hypertension. It can be seen in case of valvular diseases like aortic valve stenosis. So what are the causes of aortic valve stenosis? It's a senile changes, as well as there will be infectious or non-infectious damage to the valve. These two conditions can lead to narrowing of the orifice of the valve, and that narrowing, if it is severe, it appears like a fish mouth. So this narrowing is called as fish mouth appearance of the valve. So fish mouth appearance or the aortic stenosis can lead to development of left ventricular hypertrophy. Now, in case of senile, there is no infectious. In that condition, there will be destruction and degeneration of the wall leaflets. Because of that, there will be calcium deposition on the wall. That calcium deposition in this condition and this condition both leads to hardening of the wall, and that results in the aortic stenosis. So if there is calcium deposition because of the localized trauma and damage to the aortic valve, that localized calcium deposition is called as dystrophic calcification. So dystrophic calcification means the serum calcium level will be normal, but at the site of infection, at the site of trauma, at the site of injury, at the site of necrosis, there will be calcium deposition. That is called as the dystrophic calcification. So now they are asking that, looking at this valve, so here we can see the leaflets, and if you zoom this image, you can find these are the calcium nodules which are deposited over the wall. So this is what we call as the dystrophic calcification. So what should be the answer? It is not an amyloidosis, not a lipofuscin, not a hemochromatosis, not a fatty change. So fatty change, amyloidosis, lipofuscin, these usually affect the myocardium. So it's a dystrophic calcification. Next question. A 32-year-old man experienced heartburn and gastric reflux after eating a large meal. After many months of the symptoms, he undergoes upper gastrointestinal endoscopy and biopsy specimen of the esophageal epithelium is obtained. Which of the following pathological change is seen most likely occur. So the point you need to remember here is heartburn and GERD or reflux. So you know that this is your esophagus and this is the stomach. Stomach has a lining, columnar epithelium, and esophagus has squamous epithelium. There is a junction called as the gastroesophageal junction, and upon endoscopy this junction called as the Z line. So whenever there will be reflux of the gastric acid into the esophagus, that can causes damage to the esophageal wall, especially the lower segment. So damage to the wall can lead to necrosis, or before necrosis try to resist that pH, that acid, but the recurrent reflux of the acid can finally damage the esophageal mucosa. Now next time, whenever the esophageal basal cell they try to make new squamous cell, they are again destroyed by the acid. So now what esophageal cells do? They try to adopt the environment. Which type of environment? The acidic environment. So now instead making squamous epithelium, they will make columnar epithelials. So there is a conversion from squamous epithelium to columnar epithelium. This type of adaptive change is called as metaplasia. So you can see here, this is the stratified squamous epithelium, which is a normal epithelium of the esophagus, while here we can say these are the glands. So glandular structures, plus this is the lining of the columnar epithelium. In this columnar epithelium also have goblet cells releasing mucin. So this is from one type of epithelium convert to another type of epithelium, and this is an example of the metaplasia. So what should be the answer? Squamous metaplasia, mucosal hypertrophy, columnar epithelial metaplasia, atrophy of the lamella propria, goblet cell hyperplasia. So more likely the answer should be columnar epithelial metaplasia. And the condition is gastroesophageal reflux disease. If you don't treat it, it can lead to cancer development. Next question. At autopsy, 40-year-old man has enlarged liver with yellow cut surface on gross examination. The microscopic appearance of the liver shown in the image. Before death, the man's total serum cholesterol and triglyceride level were normal, but had decreased serum albumin concentration and increased prothrombin time. This means the liver is failing, the liver is not working. There may be development of the liver cirrhosis or hepatic failure. Because of that, there is decrease in the serum albumin and prothrombin level. Because albumin and prothrombin level, these are the two markers used to see or to check the liver function. If the liver function is declined, there will be declinement in the level of albumin as well as increase in the prothrombin time, because there will be no synthesis of clotting factors. Which of the following activities most likely lead to these findings? So they are asking the reason. So it's something like they are not directly asking what is the image given, they are asking the cause of the image. Okay, so if you know this image, if you see this image, you can easily find that if I zoom this image for you, then you can find these white structures. These are the fat lobules accumulated in the liver. So this is an example of fatty liver, which is also called as steatosis. So what are the causes? High level of cholesterol, high level of fatty acid, high level of triglyceride, and alcohol intake. Alcohol intake is also a reason for development of the fatty liver or fatty change or steatosis. So let's see what are the causes. They are saying that the triglyceride and serum cholesterol level were normal. So what would be the cause? Injecting heroin? No. Playing basketball or drinking beer, smoking cigarette, ingesting aspirin. So it's an easy answer. Taking alcohol or beer is the cause of fatty liver. Next, and the last question. A 22-year-old woman with a leukemia, it's a blood cancer, undergoes bone marrow transplantation and receives partially mismatched donor marrow. 1 month later, she has scaling skin rashes. Examination of the skin biopsy specimen reveals cellular changes shown in the figure. This change most likely results from which of the following biochemical reaction? So you need to remember that sometime there will be autoimmune destruction of the cells, and autoimmunity is also a signal for cell death. So you need to remember that if this is a cell, and then whenever there will be damage to the DNA, the cell will undergo apoptosis, or sometime the T cells, they act as an extrinsic factor and induce an apoptotic pathway in the cell and leads to finally apoptosis of the cell. So in this condition, the T cells, because she got bone marrow transplantation, this means this bone marrow is transplant and is injected in the body or in the bone from some other source. That's why this new bone marrow can make T cells, B cells that can induce an attack on its own body cell. Now there is activation of the receptor that induces apoptosis. So apoptosis means no inflammation and program cell death. So if you see histologically, you can find that the cell which got the signal for apoptosis will undergo condensation, and this condensation leads to formation of highly eosinophilic condensed granular structure with no inflammatory cell and with surrounding normal cells. So you can see this is the stratum corneum, and in the epidermis is okay. In the epidermis, just near the basal layer, here the keratinocytes are present. So here we can see a structure that is highly condensed, and this is what we call as the apoptotic bodies. Apoptotic body. An apoptotic body is a sign of apoptosis. If this apoptotic body is in the liver, then we can call as the Consilman body, which is usually associated with hepatitis C virus. So here in this case, the apoptotic body is in the skin, and the apoptotic pathway needs certain enzymes for induction of the or for the initiation of the apoptosis. And those enzymes are called as the caspases. So caspase activation leads to apoptosis. So now try to find the answer. Activation of caspases is the answer of this question. Oh, one more question is there. Okay. So a 38-year-old woman experienced severe abdominal pain with hypotension and shock that leads to her death within 36 hours after onset of the pain. For the gross examination of the mesentery seen in the figure at the bottom of the previous column, which of the following events most likely occurred? So you can see here there is severe abdominal pain, hypotension and shock. These usually can see in case of pancreatitis, or wherever there will be such clinical manifestations that will be life-threatening and so acute that even can lead to death. So if there is pancreatitis, inflammation of the pancreas, then there will be leakage of enzymes in the blood, and even that can lead to massive bleeding also, and this massive bleeding leads to hypotension, and severe hypotension leads to shock, and then there will be death of the patient. What they gave us the gross appearance of the mesentery. So, and what they're asking that where else we can see such changes. Now I'll show you that this is the mesentery, and these white areas are the, you can say it's a type of fat necrosis. So two things can be: number first, calcification; number second, fat necrosis. As we know that the mesentery and the pancreas, they have fat also. In the mesentery you can find a lot of fat, while in the pancreas you can find some fat that is converted, or we can say triglyceride, they are converted into fatty acids by the help of lipase enzyme, because pancreas has lipase. So if there is acute pancreatitis, then maybe the enzyme leak into the blood can reach to different organs and induce a fatty necrosis. So in this condition, it's a mesenteric fat necrosis. These are the multiple areas of fat necrosis. So where else we can see? In case of acute pancreatitis. So in case of acute pancreatitis, these manifestations will be there along with the fat necrosis. So onset of chest pain is because of the ARDS, because the pancreatic enzyme, they reach to the lungs and causing damage to the lung, and that can lead to ARDS. So this was some questions. Thank you very much.